So I can actually see some of her veins, so I'm just gonna try and go in between. And I'm just doing 1 unit here, and the rest will be 2. So I do use a tapping technique. It helps kind of distract the nerve endings a little bit. And I do tend to keep the needle in just a tiny bit, because if you remove the needle too quickly, then some of the product will also come out. And sometimes you just hit a pot of gold and you get a little blood. And turn your head just a little bit more. Good. Go ahead and look straight. So I personally practice bevel up just because I know where my product is going at the time. This is gonna go to her Proceris, 1, 2, 3, little pinch, 4 units, 2, 4. And then the next is gonna be her, to press her supercilii muscle, 1, 2, 3, choot. Good. You doing okay? 1, 2, 3, choot. Good. And then I'm going to take my finger, I'm going to wrap it underneath her eyebrow bone. Go ahead and bring your eyebrows in together. Good. Go ahead and relax. That way I can really isolate the head of the corrugator. Good. This one's a deep one. 4 units over here. And then 2 units over here, very superficial. 1, 2, 3. You want to see that blanching. Good. So nothing is in your face, but I do keep my finger here just for a moment. And then I wipe, and I always tell them what I'm doing because their eyes are closed and I don't want to catch them. I'm wrapping my finger underneath your eyebrow, but go ahead and bring your eyebrows in one more time. Good, go ahead and relax. You can see that I'm isolating that 1, 2, 3, big pinch. And you can almost feel the needle going through the fibers, which is good because you want to feel those muscles. Last one, 1, 2, 3. Job. I'm gonna keep my finger here one last time, but you can see as I kept that needle in just for that 1 extra second, you do retain the product on the inside where it's supposed to go, so it's a little bit more predictable of an outcome. I always wipe them up, upwards direction. And then the rules typically, I will say, and yes, it's been shown and proven that some of these rules are redundant. You don't need to tell them, but if we don't give patients rules, they might go off and do something that they're really not supposed to do. So I will say, don't bend over multiple times like you're trying on shoes, no heavy lifting, no vigorous exercise. Try and stay upright for 4 hours. When you wash your face, up and out, up and out. Do not rub your eyes. No face down massages or facials for about a week. Try to avoid any extreme heat like hot tubs, saunas, steam rooms, but you may resume all activities of normal daily living tomorrow.